side. And you're probably wondering, how do I toggle back and forth between those two? It's actually really simple. Here, you're going to use your button that you're going to use for on and off, for power, and of course for freezing, but you're just going to hold it down and the light is going to switch from one side to the other. And that's how we know now we're on our linear side. We can do that again. Now we're on our curved side. So now I'm going to share my screen with you on my phone so you can see what I'm playing with in the app. I have switched back to the linear side. I'm going to just click the top where it says thyroid, and that's going to show you all of the exams that are going to be perfect for this probe. So it starts with thyroid, and then it can also do small parts, which includes testicular, breast, and then also pediatrics, vascular, carotid, breast, MSK, and nerve. Super cool. So you can click each one of these presets to sort of optimize your image for what you're going to be scanning. I clicked thyroid, so now at the bottom here you can, it is so weird to scan yourself. Like, I'm like, which way is my indicator? I'm so used to being on this side of the probe that like being on this side is kind of weird. Anyway, so here on the screen we can see my thyroid. You can see I have like a lot of little tiny nodules on there. It's perfectly fine. I've already gotten it checked out. There's nothing to be worried about. But there you go. There is my thyroid, and you can see my trachea and esophagus in the middle there casting that shadow. And then here I'm in transverse and I'm going to my right lobe. You can see right there where my carotid and my jugular is. Veins collapse, arteries do not. So when I push, there's my vein collapsing. And the artery is still right there. So that's my carotid, and that's my jugular. And then if you're not familiar with this anatomy and what you're looking at, first of all, let me decrease my depth a little. Not that much. There we go. If you're not familiar with the anatomy, the thyroid gland is the, I'm wanting to use sonographic terms, echogenic, meaning bright tissue that you see in this like sort of a U shape. That bright thing, that is the thyroid. And I'm scanning through this transverse plane right here. So I'm going to start up superiorly, meaning up toward the head. And if I were to be doing a thyroid exam, I would just go lower and I would take this picture. The little part at the top that you see connecting like a bridge, that's the isthmus of the thyroid going over my esophagus right here, this little boop. The thyroid goes up like that. Not that big, but that's the shape. So that's what you're seeing there. I'm gonna start again. I'm gonna go back to my right lobe. There we have our landmarks. We have our jugular, it's collapsing, my thyroid. We are in transverse. Like I said, it's weird scanning yourself, okay? Okay, so we're gonna start off superiorly. We're gonna stop right there, we take a picture. Go a little lower, stop right there, take a picture. Till we get to mid. Just for fun, I'm gonna throw some color on here. Okay, that color that you see is blood. That is the movement of fluid, and it can pick up any movement. So you'll see as I move the probe around, the color's going crazy. When you have a steadier hand, you're really just picking up the blood flow. The colors is the direction of the flow. So blue in this case, because of the way the color box is set up, blue is below the baseline, red is above the baseline. So that blood flow that's below the baseline in blue is moving away from the probe. And then the blood flow in red above the baseline is moving toward the probe. So this is how we can tell directionally what is happening. And I'm in transverse right now, meaning I'm slicing my vessels. If this was my vessel going straight up, I'm slicing it, this is so hard to do, I'm slicing it this way to show you that little circle. But if I were to follow in long the flow of that vessel and open it up, now I'm following it in its long form. Here, this is in sagittal, and I opened it up. There you go, that's the whole vessel. That's my jugular. As we can see, she's collapsing good. And then I'm going to pan away from my jugular. And there's my carotid. So now we're going to go back in transverse, which is just another plane of the same anatomy. Everything is backwards. When you're scanning yourself, everything is backwards. And I'm going to move back to my thyroid. Let's take color off. Back in B mode. We're kind of at the mid-level here, so this is where we would pause. Let's do that. I paused it. And here we can take a little bit of a measurement. We're gonna take the width of my thyroid. I got 9.8 millimeters. Let's clear that and keep on going. I'm going more inferior, meaning more toward the feet. Scanning all the way through, and this is how we cut the anatomy up, the organs or the glands that we're looking at in all planes, to get sort of a 3D image in our head of what's going on, if there's any pathology, where it is relationally, what the blood flow looks like. So that was that plane, and now we're gonna go from transverse to sagittal, and I'm gonna go long ways on this gland and open it up, similarly to how I did on my carotid. And there is my thyroid in long. Okay, you can see it moves as I talk or swallow. Here we're gonna go laterally to medially. Laterally meaning toward the outside, medially meaning toward the middle. So we're starting outward this way, and that's where you see my carotid as my landmark, and I'm gonna move more medially. So first image is right there. This is the first part of my thyroid that we see. Okay, this is somewhat of like the midsection of my thyroid. It's kind of hard to talk and do this, as you can see on the screen. Everything's bouncing around. Okay, it's making me laugh. I have to. And then we're gonna keep scanning more medially. There, until we see this part right here. Scan all the way through. We can take our measurements. As you saw, we can throw color on there. And that's as simple as it is. I mean, that is just a really brief tutorial. That is one exam, not even, that's one half of an exam that I showed you. And there's so much more that you can do with sonography, with a probe like this, with an app like this. Let me clean up and then I'll come back. Okay, so I hope